Hey, everybody. Thanks for joining. My name is Derek DiCamello, and today we're in the precision weight loss science pillar. We're going to learn today about insulin resistance, what it is, why it's important to address, and most importantly, how to address it. As you know, we at PV MediSpa and Weight Loss specialize in weight loss. What we found in our patients was that we had to learn to address insulin resistance in order to get the results that we needed for our patients. Additionally, on a personal note, we recently discovered that my daughter is severely insulin resistant. So this led me down a path of learning, of researching, and redesigning our program to address this need. So let's talk about how many people actually have insulin resistance and if it's something that we even need to worry about. Unfortunately, insulin resistance is more common than you may realize. One study showed that 16% of healthy, normal weight individuals have significant insulin resistance. This percentage, however, increases to 50% when those same healthy individuals have a little extra weight, putting into the overweight category. And amazingly, 85% of obese individuals and 100% of individuals with metabolic syndrome and type 2 diabetes also have insulin resistance. If you look at these numbers across the whole United States, these numbers are huge. That means that a big majority of our population today is walking around with some form of insulin resistance. So before we get into insulin resistance and what it is, I think it's important to get a baseline understanding of what insulin does and how it actually functions in the body. So insulin is like the body's energy regulator. It helps maintain our blood sugar levels and ensures that those blood sugars are not going too high or too low. When we eat, our blood sugar rises, and insulin helps to shuttle that blood sugar, also known as glucose, into the cells. The cells then use that glucose for energy. This is kind of like the insulin being a key and the cell's insulin receptor being a lock. The key unlocks the glucose channel, allowing glucose to enter the cell and be used for energy. Whatever isn't used by the cell or doesn't get into the cell in the first place is then stored as fat for future needs. You can see in the model on the page that you've got those yellow tabs, those representing insulin. You've got the insulin receptor by that blue little donut-shaped item, and then you've got the red glucose, and as well as the green glucose channel. So what happens is insulin goes in, it matches up with that insulin receptor, and that allows that channel to open, which brings glucose into the cell. And when this happens, that gets used up as energy. So what happens with insulin resistance? Well, over time, the cells and muscles, fat, liver, and even the brain start to resist insulin. This creates a situation where they don't take in glucose as they should. This increases the body's blood sugar levels, and in response, causes the pancreas to pump out even more insulin, trying to get the cells to respond and lower that blood sugar. This process is what we call a compensatory process. While this is a normal response, things go wrong when this high level of insulin is continually pumped into the bloodstream. This overproduction of insulin puts stress on the pancreas, which eventually will impair its function and lead to type 2 diabetes. Meanwhile, the cells continually exposed to high levels of insulin may become even more insulin resistant, a state we refer to as insulin fatigue. It's a downward spiral and leads to further health issues. As you can see on that circular chart on the page, we eat food, and as a response, our body makes insulin. The cells eventually become resistant to that insulin, and much of that glucose or that sugar begins to be stored as fat in the body. When this happens, it triggers a response, and that we'll learn later on, that makes you feel tired and it makes you feel hungry. And what happens when you're tired and hungry? You eat more food, and this cycle just keeps continuing. So what does this mean for our health? Well, in the short term, individuals may experience fatigue, making it hard for them to get through their day. It may make them have increased hunger, particularly for sweets and carbs, and can lead to weight gain. It can make it difficult to concentrate, or what you may have heard called as brain fog, which affects productivity and mood. And if left unmanaged, the long-term effects can be more serious. Persistent high blood sugar due to insulin resistance is a major contributing factor to the progression of type 2 diabetes. So hear that again. So insulin resistance leads to type 2 diabetes. Additionally, there's an increased risk of cardiovascular issues, including heart disease, hypertension, and even stroke. Kidney damage, nerve damage, vision problems, these are all on the list of potential long-term effects stemming from insulin resistance. One researcher by the name of Dr. Bickman, in his book, Why We Get Sick, expressed that he has concluded insulin resistance is at the base of most chronic diseases today. He postulates that insulin resistance can be responsible for at least partially responsible for many types of cancer, heart disease, Alzheimer's disease, fatty liver disease, low testosterone in men, menstrual irregularities in women, and even some infertility issues. We do know that it's also closely associated with polycystic ovary syndrome, or PCOS. This syndrome affects thousands of women, millions of women across the United States every day. This is a hormonal imbalance and can also lead to infertility. Additionally, non-alcoholic fatty liver disease has been on the rise for the last decade. This is a result of insulin resistance and the accumulation of fat in the liver cells. And then there's metabolic syndrome. So this is a cluster of conditions that significantly increase the risk of heart disease, stroke, and diabetes. So what about obesity? We used to think that obesity causes insulin resistance, but recently the literature is showing that it's more of a cycle of causation. So with insulin resistance causing obesity, and obesity leading to more insulin resistance. Unfortunately, this insulin resistance is also linked to one of the most problematic forms of obesity, particularly the accumulation of visceral fat around organs. This type of fat is particularly harmful because it promotes inflammatory cycles and further exacerbates insulin resistance. This sets the stage for a range of metabolic disorders and is the most life-threatening form of obesity. I think it's important to identify what causes insulin resistance in order to find out how we can fix it. So what causes insulin resistance? Well, many different factors play a role. Some we can change and some we can't. Starting with those we can't is our genetics. So if you have close relatives, parents, siblings, people that have insulin resistance or type 2 diabetes, you're at a higher risk. Also, our environment plays a huge role. So certain chemicals or pollutants in the air that we're exposed to on a daily basis just by living and breathing can disrupt insulin signals and trigger fat storage. Some of these, such as what we saw with plastics made of BPA, we've identified. And now you can find BPA-free plastics that it's kind of the standard model out there for creating these water bottles. Additionally, hormonal imbalance, like those seen with PCOS and hypothyroidism, can also affect how the body responds to insulin. Even age and sex can influence your risk, with some studies suggesting variations in insulin sensitivity across socioeconomic and even racial demographics. So the good news is that while there's things that we can't change, those only make up a small portion of the problem, which leads us to those things that we can change. So insulin resistance is largely the result of a diet high in sugars, refined carbs, and unhealthy fats. These foods can cause spikes in blood sugar and insulin levels, which over time lead to cells becoming less responsive. Also, physical activity is a major contributor since exercise plays such a vital role in your body and how insulin and glucose is regulated. And lastly, don't underestimate the power of stress and sleep. So chronic elevated cortisol levels from stress and lack of sleep can cause a disruption in insulin's effectiveness. So how do you know if you have insulin resistance? Insulin resistance can manifest in a couple of different ways. You might feel tired. especially after eating a large meal, as your body kind of struggles to manage that blood sugar. You might have an increased hunger, particularly cravings for sweets or carbohydrates, as your body might not be getting the energy it needs for food. Additionally, you can have weight gain, especially around the abdomen. That's a big sign of insulin resistance. As we talked earlier, we have brain fog, concentration issues, memory issues. Additionally, you can get these dark, velvety patches of skin. These are known as acanthosis nigricans. They're usually around the neck, in the creases of the body. These are all signs of insulin resistance. Several diagnostic tests can help confirm. Fasting insulin test measures the insulin levels after fasting and can indicate how hard your pancreas is working. This is largely being recognized as the gold standard of identifying insulin resistance. The glucose tolerance test assesses how well your body processes sugar after consuming a certain amount. This gives us kind of a roundabout way of seeing how your body is handling glucose. And then the HbA1c test provides an average blood sugar level over the past 2 to 3 months. And this gives us a broader picture of what your blood sugar management's doing. A lipid profile is also useful because we know that insulin resistance changes our lipid profile, so increases our cholesterol, increases our triglycerides. These tests, when evaluated together, can kind of give us a comprehensive view of metabolic health and how they can lead to a diagnosis. And that's what we do in our clinic. So we'll run a full panel of tests. And then we'll compare those together and we'll look at the whole picture. And that gives us an idea of what your body's doing metabolically. One thing to note is that the standard labs that you get when you run a fasting insulin value is typically the high end is at 15. In my opinion, this is way too high. So we take a more functional medicine approach, and that means that we look at anything or any fasting insulin above 7 as being insulin resistant, with every degree up above 7 increasing your likelihood of getting more chronic diseases as a result. Many providers, they don't order fasting insulin. Sometimes insurance doesn't cover it. And it's maybe something that you have to specially request for, but don't feel afraid of doing that. You absolutely can ask your provider to order these tests. The good thing is they're usually fairly inexpensive if you pay them cash. And that's what we do. We actually cover these tests as a part of our program. So all of our labs are covered. Why should you get diagnosed early? Well, I think it's important that we address it early before you get that onset type 2 diabetes or any of the other complications that can arise, that hypertension, those type of things. And I think by understanding your condition, you can take a holistic approach. You don't have to go straight to the extremes. You can get it taken care of early. And more importantly, early detection empowers you. So you can make better informed health decisions. You take control of your health journey, and you can potentially reverse the course of insulin resistance before it gets started. So a quick tool that I wanted to share with everybody was with Dr. Benjamin Bickman. And really, if you answer 2 or more of these questions yes, then the answer is yes. You probably have insulin resistance. So we're going to walk through these real quick and just kind of take a quick peek at them. And as we're going along, ask yourself these questions. Do you have more fat around your belly than you'd like? Do you have high blood pressure? Do you have a family history of heart disease? Do you have high levels of blood triglycerides? Do you retain water easily? Do you have patches of dark colored skin or little bumps called skin tags at your neck, armpits, or other areas? Do you have a family member that's insulin resistant or has type 2 diabetes? Do you feel tired a couple hours after eating lunch? And for women, do you have gestational diabetes or polycystic ovary syndrome? Or for men, do you have low testosterone? And that can often look like erectile dysfunction. So again, if you answer 2 or more, then it's likely that you do have some insulin resistance. And I encourage you to pay attention, take notes, and see what you can do to address it. And we're here to help you. Finally, before we get into talking about what you can do about it, let's dig a little bit deeper into how insulin resistance contributes to obesity and causes this cycle. I feel understanding how these two conditions feed into each other is important if we're going to be able to break this cycle. Insulin resistance starts a chain reaction in the body. When cells don't effectively use glucose due to insulin resistance, blood sugar levels remain high. This prompts the pancreas to continually produce more insulin. This increase in insulin leads to increased fat storage, particularly around the abdomen, as we talked about earlier. Additionally, insulin resistance can disrupt hunger hormones, leading to an increase in appetite for those carbs and sugars. One thing to note is that fat store that we talked about earlier, that visceral fat, it isn't just an inert mass. In fact, if you were to slap your stomach and it jiggles a lot, that's a good sign. That means that more of the fat is on the outside of your muscle than it is on the inside. If you slap your stomach and it's solid, then that means that you have more visceral fat. And visceral fat actively releases inflammatory cytokines. These promote inflammation. They further impair insulin action, and it further decreases increases the mortality rate. Additionally, this fat tissue can disrupt the normal balance of hormones, and this causes appetite dysregulation. It affects your metabolism, and it's detrimental to your health. So the result, a body that's even more insulin resistant. Moreover, excess visceral fat can lead to higher levels of fatty acids in the body, which worsens insulin resistance. It's clear how obesity and insulin resistance create this self-perpetuating cycle. The good news is the cycle can be broken, and it must be broken. And what we prefer to do is do it holistically. We look at the whole person and we treat it from a couple different angles. So dietary changes are a big one. Emphasizing foods such as reducing sugar, refined carbs, incorporating healthy fats and fibers. This can make a huge impact on insulin sensitivity. Regular physical activity, and this is a powerful tool. Exercise, especially when it's varied and consistent, it improves your body's sensitivity to insulin. This also actively reduces visceral fat. Managing stress and improving sleep hygiene are also important. They regulate hormones and improve our insulin sensitivity. In some cases, we may use medical support, so we may use medications or supplements. This helps to break that cycle. So it's important to find that lifestyle that supports a healthy insulin level. This, in addition, will also support a healthy weight management. So let's get into the nutrition, right? So this is the nourishing your body part. This isn't just about eating less or more, it's about eating smart. So consistent, balanced meals help maintain stable blood sugar levels and reduce the demand of your pancreas. Certain nutrients, particularly those found in whole, unprocessed foods, these can enhance the body's response to insulin. Moreover, a healthy diet can lower inflammation. And we know that inflammation is a key contributor to insulin resistance. It's not just about what you remove from your diet, but also what you include. So lastly, one big tool we will be discussing is meal timing and how that impacts insulin resistance. Sometimes it's easier to think about what to embrace and what to remove from your diet. So foods to embrace, these include complex carbs, such as whole grains, legumes, vegetables, foods high in fiber and nutrients. These are foods that your body needs. These foods help maintain a steady blood sugar level. Healthy fats from avocados, nuts, seeds, and extra virgin olive oil. These not only improve satiety, but also are amazing for heart health. So fat is metabolized much more slowly, and it delays the rise of blood glucose. Overall, fat raises blood glucose the least out of all of the macros. And then lean proteins. So those chickens, fish, tofu, legumes, These help maintain muscle mass, which is absolutely crucial for your metabolism. This is especially important when you try to lose weight or put on muscle. With weight loss, you always run the risk of losing muscle alongside fat, and the consumption of protein can help mitigate this effect. Additionally, protein is important for satiety. We often recommend for our patients to eat around 30 to 35% of your calories from protein. Non-starchy vegetables offer a spectrum of vitamins, minerals, and fiber, while low glycemic fruits like berries, apples, and pears have really a minimal impact on blood sugar. The big caveat here is juices. Juices pull out all the fiber, they pull out all the good stuff out of fruit, and they only leave the sugar. You need the good stuff. That's what delays that absorption of the sugar and turns a very unhealthy thing into a healthy thing. On the flip side, there are foods that we want to avoid or limit. So refined carbs, those are things that are found in like white bread, pastries, or processed foods. These cause rapid spikes in blood sugar and insulin levels. These foods are one of the main driving factors of insulin resistance in the diet. Sugary beverages, sodas, juices, these provide a quick rush of glucose, but they don't have any nutritional benefit. Trans fats, often found in fried foods and baked goods, these can promote inflammation and are absolutely detrimental to your heart health. Excessive alcohol consumption can lead to weight gain and erratic blood sugar levels. And high glycemic fruits, while healthy in moderation, we should make sure that we're not overdoing them. So making sure that we're eating those really healthy fruits and vegetables with our meals, but not only eating fruits. So I want to chat a little bit about intermittent fasting. Specifically, intermittent fasting, or IF, and its relationship with insulin resistance. Intermittent fasting is a pattern of eating. It doesn't dictate what you eat, but rather when you eat. The idea is to cycle between periods of eating and fasting. This could mean daily 16-hour fasts, fasting 24 hours twice a week, or many other variations. The goal is to allow your body time when it's not processing food, which can lead to various metabolic benefits. So in order to explain how intermittent fasting helps with insulin resistance, let's look at what happens with just 3 meals a day. We wake up, we eat breakfast, we have a sugar spike, and our body responds by raising insulin. We then eat lunch, which causes another sugar spike and another raise in insulin. And then we eat dinner, and then this sugar spike. This causes more insulin. You can see how the insulin level is consistently high throughout the day. Now, if you add in snacks, which according to some nutritionists is healthy for you, you'll find the insulin levels stay elevated all the time. You don't ever drop back down until you go to sleep, at least. This continual elevation of insulin rise is what causes insulin resistance. It's the same concept with medications. We know that someone who takes antibiotics for short bursts does fine. But when you give antibiotics for a long period of time, or you don't give a high enough dose to treat the infection, you run the risk of somebody becoming resistant to antibiotics. So let's look at the 8-hour eating window. We have 16 hours of low insulin and 8 hours of high insulin. And really, this is what our bodies were designed for. These peaks and troughs of insulin, not sustained elevation. If you think about our ancestors in the hunter-gatherer times, we would often go days without eating, then feast on whatever we were able to eat. So remember, it's that sustained elevation is what causes insulin resistance. Beyond improving insulin sensitivity, intermittent fasting has been associated with many benefits. So these include weight loss, improved brain health, reducing inflammation, reducing the risk of cancer, reducing the risk of heart disease. And in some studies, people who were type 2 diabetic completely got off all of their medication after intermittent fasting. And that's what we've seen in our clinic as well. And lastly, intermittent fasting has been shown to increase our overall lifespan. So where to get started? So first, consult with a healthcare professional, especially if you've got some kind of underlying condition like type 2 diabetes. And start slow, perhaps with shorter fasting periods, and gradually increase as your body adapts. Stay hydrated during your fasting periods. And when you do eat, focus on nutrient-dense foods that provide energy as well as satiety. And then listen to your body and adjust as needed. Intermittent fasting is flexible and it can be tailored to fit your individual needs and lifestyle. So we have our intermittent fasting guide, and you can also check out our intermittent fasting webinar. Now we're moving from the dinner table to the gym or the park or the living room, wherever you prefer to get active. Exercise isn't just about burning calories, it's about creating a body that's more responsive to insulin. So we're shifting our thinking, right? We used to think of exercise, we're going to get out there, we're going to burn calories, and that's going to burn the fat, and that's going to lose the weight. Well, we know that that's not exactly how it works. That's not how exercise affects our body. What we have learned is that even a single session of exercise can increase insulin sensitivity for the next 24 to 48 hours. So regular physical activity helps muscle cells by absorbing insulin or by absorbing glucose and effectively using insulin. So it makes your body a better responder to insulin. And when it comes to weight management, studies show that those on a routine exercise regimen don't necessarily lose weight faster than those who are not. However, they maintain their goal weight much longer. So after they've reached their goal weight, those who are exercising actually maintained that weight for much longer than those who didn't. And lastly, it helps in reducing body fat, particularly that visceral fat that we talked about. So it's a really important piece of the puzzle. So what types of exercise should you consider? Aerobic exercises like walking, jogging, cycling, or swimming. These are great for improving cardiovascular health. Resistance training, whether it's weightlifting or body weight exercise, these help maintain our muscle mass and promote that lean muscle growth. And for those who enjoy a challenge, you've got the high intensity interval training or HIIT training. These are short bursts of intense exercise followed by periods of rest, and they can significantly boost your metabolism. Now, overall, when you ask which one affects insulin the most, so HIIT is at the higher end of that list. Weightlifting is second, and cardio is third. But really, all that means is that you can do shorter training sessions of HIIT training compared to sessions of cardio training to get the same effect. So you may have to walk a little bit longer, run a little bit longer, make those a little bit longer sessions, but you can absolutely get the same effect as if you were doing a shorter session of a HIIT training. So it really comes down to preference, and it's about what you're going to do. The best exercise is the one that you'll do. So how to get started: begin with activities you enjoy and gradually increase in intensity and duration. I always tell people, keep it simple. Set realistic goals to keep yourself motivated and aim for about 150 minutes of moderate intensity aerobic activity or about 75 minutes of vigorous activity. And then add in a few days in there doing some strengthening activities. That's one of the best regimens you can follow. Monitor your progress. See how you feel. Adjust it as you need it. If you have to start with 10 minutes and then build up to 15 minutes, do that. Start where you're at and just build slowly. So a few more things that we should address is our sleep and our stress. So sleep is a fundamental process during which your bodies regulate hormones. And this is critical for hunger, satiety, and yes, insulin sensitivity. Studies show that those who do not get adequate sleep eat almost double the amount of calories as those who get enough sleep. Additionally, these are often high carbohydrate and high sugar calories as our bodies are screaming out for energy. And we know that those are energy-packed macros. On the other hand, chronic stress is often a silent disruptor. So it elevates our cortisol. This is the hormone, when consistently high, can increase glucose production and often leads to insulin resistance. Again, we get into this concept of spikes are good but sustained elevation is bad. And it's okay for short bursts of stress, as this is a natural and helpful process for handling emergencies in life. But in today's society, it's often always there, and it's always looming over our heads. And it's that continual elevation that's detrimental for us. So good quality sleep and effective stress management. These aren't just luxuries, right? They're necessities. They're things we have to get our hands on. So just a couple of tips before we go forward. Mindfulness, meditation. These are awesome practices to help calm the mind and reduce the body's stress response. Deep breathing exercises. These are simple, yet they're scientifically proven to be effective. These can lower your stress levels. It lowers your stress hormones. And overall, it can improve your entire emotional well-being. And then don't forget about physical activity, right? So we know that physical activity is a powerful stress reducer. And then lastly, don't underestimate the power of adequate social support. So connecting with friends, family, or support groups. These can provide the emotional and the psychological well-being that's crucial in stress management. There's a great teaching on the science of meditation and mindfulness. It's by a neurobiologist, Anthony Huberman. It's pretty long, but if you just Google meditation and mindfulness by Anthony Huberman on YouTube, you're going to find it's like 2.5 hours long, but it's packed full of really good information on how to get started. So while lifestyle changes, these are the first line things, right? So these are the treatments that we all have to have in order to manage our insulins. Sometimes it might not be enough. And sometimes as a provider, we go to some medications and some treatments. So metformin, this is often the first medication prescribed for insulin resistance. It improves sensitivity and it lowers glucose production in the liver. It's really considered the gold standard of medicine at this point. However, it does come with side effects. You can often get nausea, vomiting, diarrhea, constipation, a lot of GI upset with these medications. And I often tell patients to give it time, because the longer you're on it, the more your body adjusts to it and you have fewer side effects. GLP-1 agonists are another class of medications. So we use these as weight loss medications. However, what we're finding, and one of my theories is that why these are so effective, is that in addition to suppressing appetite, it's also affecting insulin. And I think it's this increase in insulin sensitivity that's really helping people to lose weight on these medications. Berberine. So this is a dietary supplement. It's not a prescription one. It's over the counter. It comes from the plant barberry, and it's known for its potential to improve insulin sensitivity and metabolic health. And some great peer-reviewed journal articles out there have shown that berberine has an equal effect on blood sugar as metformin, and it has a greater effect in treating insulin resistance. So often what I'm used with a lot of my patients, especially those that don't want to do metformin, I'll offer berberine as an alternative. And some patients will go straight to that because they want that more natural approach. Inositol, that's another supplement. And like berberine, it reduces insulin resistance and it improves blood sugar. In some cases, in severe cases of obesity, bariatric surgery has been known to improve insulin sensitivity, and this makes sense, right? It kind of puts your body into a period of bringing in fewer carbs, and oftentimes overnight, type 2 diabetes and insulin sensitivity is fixed with bariatric surgery. So there's some great resources out there if you want to learn more on insulin resistance. The Obesity Code by Dr. Jason Fung. So this is an awesome book. It offers some insights into the underlying causes of obesity and strategies on how to overcome it. Why We Get Sick by Benjamin Bickman. So this really kind of sheds light on how much of a hidden epidemic insulin resistance is, and how it's really at the root of many, if not most, chronic diseases. Additionally, the American Diabetes Association, there's some great information out there. They have teachings, they have streams, they have webinars, all across diabetes and insulin resistance. And then again, make sure to follow our social media groups. Join our Facebook group, and in that group we answer questions. We talk through the different types of insulin resistance. This is where we're hosting a lot of these live sessions, is coming to that group first. So join us over there and kind of become part of that movement. And then you can always reach out to me with any questions or comments. All right. Thank you for joining.